Now we're going to move on to 5 and 6, and we'll start off with 5, which is motor arm. And in motor arm, we're going to assess for drift. You can do this with your patient sitting up if they're able, or laying in the bed supine, either way. We're going to start demonstrating a normal or a 0 for 5A, or for 5, with our patient raising up her arms at 45 degrees and trying to hold them for 10 seconds. And what we're looking for is drift. Again, we'll show you first what 0 looks like. Okay, Sandy, I'm going to have you raise up your arms with your palms down. Excellent. And can you hold them there for me for about 10 seconds?
Okay.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, you can put them down. Thank you. That was a 0. She had no drift. She was able to hold up her arms at 45 degrees. I mean, depending on if she's laying down or in the chair, and she was able to hold it for 10 seconds without any kind of a drift. Now we're going to demonstrate 5 of the upper extremities, showing a 1, which means that her arm will drift, but it's not going to fall to the floor, and it'll drift down before the 10 seconds. Again, we're looking at both extremities. Now, if you have a patient that already has an injury or paralysis to one limb, then we would just assess the other limb, okay? So it's kind of, you're going to rate what you've got. Okay, Sandy, can you go ahead and extend both your arms, palms down? Hold those for me for about 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, thank you. So she had a partial drift on the left. So on this particular score, we would mark left arm and we would give that a 1 for a partial drift. Now, if we were to demonstrate what a 2 looked like, a 2 is when there's some effort against gravity, but the patient's not able to hold that extremity up and it drops. Again, we're going to look at the left and the right. You can choose to do one extremity at a time depending on what's going on with your patient. So we'll see how she does with this one. Again, we're going to demonstrate what a 2 looks like. Okay, Sandy, can you extend both your arms with your palms down and hold them for me? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, good. Thank you. And this time, she would have a 2 because she was making an effort against gravity, but she was not able to keep the extremity up for the 10 seconds, and it fell to the bed. So we would give her a 2 for that. Now we're going to demonstrate what a 3 would look like. A 3 is that the patient is not able to hold that extremity or extremities up at all, and they immediately will fall to the ground. Now, according to what's going on with your patient, if your patient is aphasic or stuporous, depending on how alert they are, depends on how much assistance you're going to give them. Obviously, if they're comatose and unresponsive, you're not going to do this test. But if they're semi-responsive, then you would support their limb and say, Sandy, I'm going to have you hold your arm up for me as long as you can, okay? So try to hold up your arm, okay? Now, I would do a better job if I supported her as she went down there. All right, hold up your arm. Okay, very good. And immediately it drops to the bed. And I would also check the other side. Now, Sandy, can you hold up your left arm for me? And her left arm may do better than her right. So we want to rate those separately. Again, both of those were 3s. There was no effort against gravity. They both fell. So a 3 on both sides, right and left. And then a 4 is no movement at all. So again, if I try to help her, encourage her, hold it up, and there's no effort against gravity, then that would be how you would rate a 4. If the patient has an amputation or a fused joint, then you would put a 9 because you're not able to assess that particular extremity. But you would do whichever one you could as best you can.